topic will be on Ecuador's major under-recognized issues in population health. Today we will bring forth different health professionals that will discuss their opinions on the current major health concerns, including HIV/AIDS, lower respiratory infections, and mental health. Ecuador is in the midst of an epidemiological transition, going from communicable to non-communicable diseases. Quickly, we will turn to some statistics.
From 20 years, 1990 to 2010, HIV rates have increased by 200%. Likewise, mental health is a part of the 5 of the top 20 DALYs, and these statistics have all increased as well in the past 20 years. Lower respiratory infections have decreased over the 20 years. However, it has not decreased by a significant percentage. It is still an important public health issue as it is the leading cause of death amongst children and the elderly.
Our first guest today is Rosina, who will be discussing HIV and AIDS in Ecuador.
Hi, my name is Rosina Hamoni, and I'm a public health official coming back from Ecuador. I will be discussing human immunodeficiency virus, HIV, a transmissible virus that causes AIDS. HIV is transmitted through infected bodily fluids. Over 40,000 people were estimated to be unaware that they were infected with the virus. The unawareness of any highly transmissible disease is hazardous to the population and scary for public health officials to handle. Risky behaviors such as unprotected sex or needle sharing are common ways to spread the disease. With this, you can see the urgency that Ecuador needs to bring forth action.
With your experience in the public health field, what do you believe needs to be done to solve that?
In alliance with Red Cross and other major groups, we will be setting up nonprofit clinics. These clinics will provide education, condoms, support, medications, and nurses to help the Ecuadorian population, especially those in more rural areas. We will be recruiting volunteers worldwide. This will target the at-risk population, and these clinics will be distributed throughout the country. The expected results are lower prevalence rates, and it is hoped that the rate of transmission of HIV will be decreased by at least 30%.
Our next guest is public health official Sonia, who will be speaking about lower respiratory infections.
Thank you, Jessica. The risk factors for lower respiratory infections include air pollution and weakened immune systems due to the lack of breastfeeding and anemia. The main cities of Ecuador are highly polluted. Therefore, we will work with the local governments in major cities to introduce alternative fuel sources, and we will educate residents on how they can improve their home air quality. Furthermore, anemic children have increased risks of respiratory infections than non-anemic children. We intend to recruit community workers to educate mothers about the benefits of breastfeeding and an iron-rich diet. They will provide examples of and teach how to grow iron-rich foods. If these plans are successful, we hope to see a reduction in respiratory cases in anemic children within 1 year and a gradual decrease in air pollution within 5 years.
Our last issue is about mental health with special guest Nell Jones.
Thank you, Jessica, for having me on your show. We're hoping to lower all mental health risk factors, including interpersonal violence, major depressive disorder, anxiety disorder, alcohol use, and self-harm, which are all very high in Ecuador today. Although we know mental health is most prevalent in individuals aged 15 to 45, it does affect the whole entire population. Our current action plan will be to take a community-based approach by decentralizing services and adjusting government policies. We will focus on promotion and prevention through community-based mental health services, as we are creating day health care centers throughout the country. Ecuador is the only country in its region that does not have these facilities today. These services have a profound positive effect on the community as it decreases the fear, the social stigma, and reduces the rates of those affected with mental health. It is unethical that less than 25% of the population is covered for necessary mental health services, and that out-of-pocket financing by the patient or their family is the only way to seek critical care. To fix this, the government needs to make an official mental health policy today.
Our last guest today is Tess, the Health Science Director from SFU. What do you think about these health issues?
From my experience, I have worked in both Vancouver, BC and in Quito, Ecuador. I have noticed such big inequalities in the healthcare services at a global perspective. With my profession, I feel compelled to bring these issues forward to the Minister of Health and other stakeholders in order to implement these action plans. I also strongly believe in the power of education. I teach a class on global health at SFU, and it is amazing to see so many of my students bring their passion to life to create global change. All universities should be educating their students about these issues to raise awareness and make students want to give back and provide Ecuador with the external support it needs.
Thank you for tuning in to Global Health Report 2014. See you next month. Ciao.